It's a statistic that most of us have heard and been terrified by, that 1 in 3 people will at some point in their lives be diagnosed with cancer. However, there are continuing advances in drugs and treatment, and by 2040 the number of people living with and surviving cancer is expected to have increased by as much as 1 million a decade. But I'm joined here today by Dr. Snek, a Medical Director at Bupa. So Dr. Snek, what trends are we seeing in relation to cancer?
Well, Ian, as you just mentioned, the rates are going up at an alarming rate.
In all sorts of cancer?
Well, the most common cancers in the UK are breast cancer, colorectal cancer and prostate cancer. But lung cancer is on the rise, as is testicular cancer and other forms. So the ones to watch out are those first 3 that I mentioned. But the reason they're on the rise is not just because there's more cases of them, but because we're getting better at diagnosing. And the good news is we're getting better at treating. So more people are surviving. 1/4 of people who are hit by cancer will be survivors of cancer, and that means there's more incidence of it.
So what will the effects of that be in general?
People are looking for new treatments, and the medical advances that have happened over the last decade in treatments for cancer have been significant. Some of the drugs that have come out to treat breast cancer are really targeted therapies that offer much better survival rates. There's been advances in radiotherapy, so that instead of having generalised radiotherapy over a whole big area causing lots of side effects, you can have now really pinpointed, targeted radiotherapy that hits just the cancer and not the surrounding tissues. So what it means is that people are getting more personalised treatment and they're getting more accurate treatment, which is leading to better outcomes and better survival from cancer.
I guess all cancers are slightly different, but what can we do to reduce our risk of getting any form of cancer?
Well, actually, one of the things that causes cancer is your lifestyle choices, and increasingly we're getting more evidence to say that certain things you do with your diet, obesity, and indeed what we well know, smoking, are risk factors for cancer. So the things that you need to be aware of are, do you have a family history? And if so, watch out for the screening that you need to do. Things like getting the HPV vaccine for teenage girls so that they can stop developing cervical cancer. Don't smoke, lead a healthy lifestyle and exercise regularly. That decreases all of your risk factors.
If people want to find out more information, how can they do that?
Well, if you go to Bupa's online pages, you'll find a wealth of information about cancer there, how to avoid it, or indeed if you have it, what it means for you. There are risk assessments that help you predict your risk of cancer, and we have a form you can fill in to get real-time expert advice from one of our cancer specialists, oncologists, that can give you some reassurance or advice on your next steps.
Thank you very much, Dr. Snek.